I'm Dr. Sarah Vaughn. I am a physician at HRC Fertility. I work out of our San Francisco and Silicon Valley locations. So I went to medical school at the University of Texas in Houston. I was in Houston because I went to Rice and really fell in love with the Texas Medical Center. I did my residency at Cedars-Sinai in Los Angeles, and then I practiced as a fellow at Stanford. I had a reproductive embryology course as part of my second year curriculum, and a reproductive endocrinology and fertility doctor came and taught a couple of the classes, and I loved that class, and I asked her if I could shadow her, and I went to her clinic and I spent one day with her, and I had one of those moments where it just all fit for me. I can tell you all of the reasons why I intellectually thought that it would fit. I think that I remember thinking it was such a dynamic job, one filled with deep conversations about people's hopes and dreams and values, and a really intimate conversation with people about what they wanted in their lives, and then really interesting procedures and hands-on work. And I liked the combination and the dynamic atmosphere of all of it. But really, I think what spoke to me more than anything else was just the, to me, it was just like an extension of what I had wanted in pediatrics, which was to support families. And I loved the idea of sitting down with people and deeply thinking through what their family planning goals were. I just really like the concept of being in a really intimate space with people and helping them navigate that. I don't know, I just sort of fell in love with it, and I think that to this day, the experience, I've fallen in love with it at different times in different ways as I've grown older and gone through my own fertility journey, reproductive planning, having children, creating my own family, creating my own community, being really intimately involved with not just patients, but the people around me who are on that journey. And it's just gotten to be deeper and deeper. When I decided I wanted to go into reproductive endocrinology, I was 24. So, pretty young, and I didn't know a lot about the world, but I just felt like I fit. We have improvements really in all areas of technology, from the electronic medical record to software and hardware solutions that we use in the clinic and the lab. And in my mind, those innovations that are well thought out have really improved our ability to have safe reproducibility. And some of the technologies I think have been really important. One of the technologies that we use in the IVF lab helps us double check that we're using the right sperm, the right eggs, the right embryos, and not just relying on human checking, which historically we've done by having multiple people check, but still it just adds that extra level of security, which I think is very, very important. Well, I think every day is super different, but I really enjoy the people. I'm a very large extrovert, and I like to be connected to people. And so I love being part of a team that's really driven to create that connection. I love the days where I feel like we're all functioning together to create this really safe environment for patients to be carried through their journey. And medicine in general, coming to a doctor's office, being a patient, I think sort of no matter what context that's in, it's a vulnerable place to be in. And so I've been a patient, I've had family members that are patients, and I remember that feeling of really needing to be carried. And when everything is just exactly the way it should be. Patients feel so safe, and we do such a great job. And that feeling of like camaraderie, where we're doing it together and we're sharing together in the ups and downs of the emotional journey. That's just great. It's just like, it's such a huge part of why I love what we do. So everyone's journey is so different, and I think that it's really important, really, to spend the beginning listening to hear, what they need to hear, because not everybody needs to hear the same thing. But I would say that the most common thing I think most patients need to hear is that whatever their emotional experience is like, that it's really normal, and that it's okay for them to express it. It's okay for them to ask for support. It's okay for them to set boundaries. When I came to HRC, I felt safe. I met everybody involved. I walked through the lab. It was clean. It was efficient. It was optimized. The culture was really what I had been searching for. People who really come to work with a positive attitude and are emotionally present and support each other and are professional. I just felt like I would be a part of a great team with the best technology, and that was really important to me.